You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, breast augmentation, breast lifting, reconstruction, and what this doctor calls a mommy makeover, sweeping the Coachella Valley. If you are unhappy with your breast, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Mo Zakhireh. Dr. Zakhireh is the owner of the Cosmetic Surgery Institute of Palm Desert. And today's topic is breast surgery, all types of breast surgery, and something new that is pretty much taking over. A lot of talk here in the Coachella Valley about mommy makeovers. Dr. Zakhireh, welcome to the program.
Thanks, Randy. It's good to be here.
Good. Now, before we get into today's topic, I always feel like everybody knows you in this town. A lot of people do. But for those that don't, let's talk about your background, your training. I know you're a board-certified plastic surgeon.
Sure. I did my general surgery training at Harbor UCLA, and then I did my plastic surgery fellowship at the University of Utah. And then I was asked to stay on staff there as a professor of plastic surgery, where I trained medical students and residents and fellows for almost 5 years before I came out here. And when I first came out here, I had never been here. I came here for a friend's wedding, fell in love with it.
Is that right?
6 months later, I found myself here. And just recently, I purchased the Cosmetic Surgery Institute.
That's right. Dr. Ball is retired, so now it's just you. Mm-hmm. And you have another plastic surgeon there.
Right, and Bruce Landon, and we recruited him out of Tampa Bay, Florida. Great guy, very
They're calling
talented.
You the dream team, by the way.
Yeah,
already in this town.
We're actually both very excited because I think both of us are sort of the same way. This is our passion. Our philosophy is to just give good patient care, do good surgeries, and we're both board certified.
Now, Cosmetic Surgery Institute. We've had you on the show talking about facelifting, tummy tuck, just about everything. Mm-hmm. What all do you do there?
We do, just like you said, facelift, tummy tuck, liposuction, and breast augmentation, breast lift, and breast reduction.
Okay, and you have full spa services.
Yes,
as well.
we have full ancillary staff spa services. We have two very talented and wonderful estheticians who have a big following, not only in the Valley, but also from San Francisco and even Beverly Hills. We have a full array of laser services with a wonderful laser nurse, Paula. She really knows her stuff. And also we have Peggy, who's a very talented Botox and Restylane.
That's right.
And
today's topic, breast surgery. One of the new things, and I smile when I say it, you call it a mommy makeover.
The mommy makeover is very interesting. Ever since I left training back in 2000, I've been sort of perfecting my technique, so to speak. And it has led to the mommy makeover, where we go in, do a combination of liposuction of the back and flanks, the love handles, sort of what they call the muffin top now. And then we also do a tummy tuck. We properly tighten the muscles. After pregnancy, especially if they have had a large child, the muscles are stretched out. And then also the breasts, because of multiple breastfeedings and breastfeeding for a long time, their breasts begin to fall. And after the kids are old enough, they start to kind of look in the mirror and they're like, I don't feel sexy anymore. And the thing is
they want it back.
Yes, and it's very important because when they come in, the majority of the mommy makeovers, they come in with their husbands. And it's very interesting because the husbands say, well, I love her the way she is. To me, she looks great. She looks sexy. And I always tell them, you know what? She has born the kids. She has now raised the kids. So you have to be supportive of this decision. She's not doing it for you, I hate to tell you.
Is that right? Okay.
Yeah. After my surgeries, they look so sexy and curvaceous. A lot of them come back and say, I look better now than I ever had before, even before kids.
Now, the mommy makeover, is that something you advertise or just something you call it that internally?
We started calling it that internally. We gave it a name probably about maybe 3-4 months ago. Okay. And it's amazing how
so a little bit of a breast
taken
lift.
Off.
Little lipo or
not
tummy
necessarily
tuck?
Breast lift. A lot of times these patients come in and their breasts just lost a little bit of volume because of breastfeeding, and you put in the breast implants and they look great. Okay, so the thing is, though, let me tell you this: as a rule, in general, when I look at that patient the first day, if I put, let's say, a pencil or my index finger in their breast crease, and if their nipple falls above the breast crease or that marking pen, then they are a candidate for breast augmentation. If their nipple falls below that breast crease, then they're a candidate for breast lift. I do the breast lift, and then I bring them back 3 to 4 weeks later and have them do a breast augmentation. In my opinion, the incision has a risk of opening up or getting infected, and worst case scenario, the implant actually puts enough pressure on the nipple areola complex.
So you do the lift,
actually choke it off.
The first week, have them come back.
About 3 to 4 weeks later.
And do an implant. What about scars for lifting? Are you better now at hiding scars than you guys were 10, 20 years ago?
Yes.
And is that the number one fear that women have?
Absolutely.
So scars should not be something that keep a woman from getting a lift?
Absolutely not. You know, the patients that come in that want a breast lift, usually, you know, at first, they're very concerned about the way they look. They can't wear a look-up dress or a look-up blouse, you know. So what happens is, you know, after the surgery, I mean, they're able to wear their clothing without looking matronly.
Okay.
You know, and they have a nice cleavage, they have a nice bosom. So absolutely, I mean, they automatically feel good about themselves. It's actually one of the surgeries that is, you know, we have the highest rate of patient satisfaction after a breast lift or a breast reduction.
This is a very popular procedure. And you've told me before that not everybody's doing it the same way.
Right.
Just like the facelift or these other things, completely different techniques.
Sure. Well, let me.
Is that true?
Of course, yeah. Okay, let me tell you this. I mean, there's a lot of different variations.
Because you're the breast guy in this town.
Oh, well, thank you.
I saw you out and about, by the way, went over to your table. There was, you know, the breast, it was the rep, the implant rep.
Right.
He said you own this town for breast. I mean, you're a very busy guy.
Yeah, I appreciate that. What happens is that, okay, so let me tell you this. When a patient comes in the door into our office, the first thing that we do is obviously we take their history and physical. Second thing that I do is I have them stand up. I ask their measurements. I ask how tall they are, how much they weigh. More importantly, I ask them how active they are. Do they wear high heels all the time? What kind of work do they do? Do they do, you know, lifting at work? Do they have kids? Do they jog? Do they mountain bike? Do they ride ATVs? Do they horseback ride where, you know, they're bouncing? Things like that. All these things are very important. The other thing that I do is I have them put on a special bra during the sizing, and the cup on the bra is bigger. So I have them put on that bra, and then
Is this to determine size?
Right, yeah.
How accurate is that?
It's very accurate.
Okay.
Yeah, and I actually go in there with Becky. Becky's really gotten really good at sizing also with me. So I go in there and we try on the implant sizers, and then we have them put on a tight shirt and look in the mirror. I want the patient to see. I want it to register with their own eyes what they look like. And I always ask them, I say, pretend that you don't know yourself. Pretend like your reflection in the mirror is a stranger and you're meeting them for the first time.
Why do you do that?
Because I don't want their eyes to go into a shock. I want them to look objectively at the way their shoulders line up with their hips, and we use the breasts to tie the shoulders into the hips, so they have full symmetry. So what happens is that, you know, when you first meet somebody, subconsciously you size them up, you look at them, and you size them up head to toe, right?
All right.
And I personally don't want my patients. You know, I don't want people's eyes getting stuck at their breasts. I want them to have a fully balanced
So
body.
when they do that, do they sometimes say, this is way too big?
Absolutely, they say that.
Okay.
A lot of times they say that. But after their mind's eye gets used to what they're looking at, then they're like, you know, and I explain to them your shoulder has to be in balance with your breasts and your hips, then they're okay with it. You know, a lot of times people come in and they have, you know, wide shoulders or square shoulders. And so what happens is if you size them with small implants, then their shoulders swallow the implants and they look like they haven't had anything done.
Okay.
On the same token...
Because do they still come in? They say, you know, they know how many cc's that they want?
It depends. Some people come in, they ask for cc's. Some people come in with pictures. Some people just come in, they say, okay, you know what, I heard you're great at sizing and it's your forte. I trust you. Go for it.
Is that your forte, by the way? Picking the right size for their...
Yes,
frame?
Absolutely. Absolutely.
Is that what separates you then?
Yeah, and
because you're a popular guy, and I always wonder, because it seems like such a straightforward procedure. Breast augmentation, breast lifting. Because, frankly, it seems that everybody's doing it the same way, or that it's such an easy procedure.
Well, there's all these fine nuances to getting a perfect look and knowing what your patient's expectations are. Very important. And that's why I take the time to size my patients. Actually, I don't size my patients on the operating room table. I size them in the room the first time I meet them, because I want it to be an interactive process with their husbands, with their, significant others, things like that. Now, the other thing is that you could just as easily have a patient that comes in with narrow shoulders, and then you could oversize them, especially if that patient is short, and then they could look top heavy, or they could look matronly. I'm like, I don't want that for you. I think we should go a little bit lower. So that's very important. Once the sizing is done, then I educate them towards the difference in implants. Just like what I told you, the difference between saline and silicone, the difference between the newer silicone gels and the Dow Corning implants that they used to use. And also, there's a difference between textured implants and smooth shell implants.
I talk to some guys, and they'll say, not much you could do for cleavage. It's whatever you were born with. That's not your feeling, though, you say?
No. If somebody absolutely wants cleavage, I come in, and I'm a big fan of fat grafting. I come in and I take some fat from here, and I fat graft their inside of their breast, so it builds up their cleavage.
Really?
And it looks awesome. It looks
Adding
awesome.
their own fat to the cleavage?
Yes.
Have we ever talked about that before? I've never heard that before.
No, the thing is...
Are a lot of guys doing this?
No, and that's the whole issue that I talk to you about, is that, I think because this is my passion and I just love doing it, I always think outside the box, and I'm like, okay, what's
You said on my last show,
what's
you're a
next?
thinker. You're always thinking of how to improve things.
Well, you got to analyze the problem and solve it. But you got to solve it effectively. You can't solve it with an overnight Band-Aid.
Do you see the end result? I mean, when you look at somebody, you see the end result in your head?
Right.
Do you really?
And that's the coolest thing.
You really do?
It is really neat to be able to see that. Now, let me tell you this. I didn't used to see that, but now that I have experience, and I think the important part is that, I do a limited number of surgeries for that aspect, because I love the surgeries that I do, and I do them a lot.
The nurses say you take your time.
Yeah, absolutely. You can't rush it. And I operate 5 days a week, and I take my time. And that's the nice thing, is we have our own operating rooms, and that's the most important part. You have two of them, don't you? Part. Yeah.
Very good. Listen, we have to take a quick break.
Sure.
You have a lot of photos, and we're running out of time. So we come back, these mommy makeovers.
Sure.
Okay. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. With us, we have board-certified plastic surgeon, Dr. Mo Zakhireh. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Brand new show here with board-certified plastic surgeon, Dr. Mo Zakhireh. We're talking about breast lifting, developing cleavage. You have some photos and mommy makeovers. Tell me about the mommy makeover for those people just tuning in.
Sure. Tightening the muscles, pulling down that extra skin. Tummy tuck. Pulling down that extra skin, cutting out all the stretch marks, or as much of the stretch marks as you can, to tighten things up, and then doing a breast augmentation. And by the way, I got to point this out to you. When I do my breast augmentations, I put my implants under the muscle. It's very important to put the implants under the muscle for mammogram issues. Okay. It pushes up the breast tissue from below, so on mammogram it's more effective.
What about your incisions? Where do you place them?
That's the other thing I wanted to talk to you about. No.
I was kidding, by the way.
You're killing me.
We had to get you to smile on the program today.
Okay, here's the deal. I know why you brought that up, okay? I've said this before, and I'll say it again. The belly button, the armpit, it's what you see on local plastic surgery TV shows.
Okay.
I have no business dialing long distance. I'm operating here.
So it doesn't give you control.
Surgery is traumatic to the body, okay? You got to go in, as a good surgeon, if you're going to do surgery, you got to go in through the shortest distance, do what you're going to do, and get out. Okay? And yes, it decreases control, definitely.
You go underneath?
I go into the breast crease. I make a small incision. Anatomically, the bottom portion of the pec muscle is right at that incision. I literally open it up with my finger. It's a non-traumatic procedure. It's a what I call it's a layer that doesn't bleed. I open the pec muscle, get underneath it. I put in the implant. I'm done.
So you like
it's very simple.
And the result,
and
you
then
believe,
I close the incision in multiple layers, so that 6 months later, that incision blends into the breast crease. The result is absolutely phenomenal.
Do you tell your friends, because you have a lot of, I've met two of your friends, I guess one in Florida, somewhere else, that are plastic surgeons. Do you tell them this? Do you guys talk about where to put the incisions?
Let me tell you,
because
Randy,
you like underneath.
we have heated discussions. We sit there and just get into a argument and fight and this and that. I do this and we do that and I do that. No, this is wrong. But it's a very healthy discussion because we have mutual respect and admiration.
And you told me, you said, but I'll put my photos against theirs.
Oh, absolutely.
Your photos do look a little better.
Any day.
Hopefully they won't see the show, but yours do.
Thanks.
Okay, so these mommy makeovers, what are we looking at here?
So the mommy makeovers, okay, first of all, you know, this mom came in, and what I want you to notice is that she had that empty sac syndrome, okay? And she had, look at that belly button, okay? The belly button looks sad. Overhanging skin over the belly button.
Stretch marks.
A lot of stretch marks. Also, look at her.
This is a young patient, it looks like.
Yes.
Because when I think of tummy tuck, I think of a drastic situation.
Well, that's
like somebody with a big, giant overhang.
That's the thing about these mommy makeovers. Interestingly enough, the majority of these moms are young patients, and a lot of them are professionals. They do this and, you know, they go back to work. Now, the other thing I want you to notice is this patient's waistline. Yes, she's got a good waistline, but after the tummy tuck portion and the combination liposuction portion, her waistline has been significantly...
And stretch marks are gone.
Right, and the stretch marks are gone. Look at the belly button. Belly button, very important. Looks very, very natural. And the breasts, again, they look natural. They match the shoulders and the hips. This patient, in her clothing, in her jeans, oh my gosh, looks amazing.
So a tummy tuck.
If a patient comes in and they only need liposuction, you offer them only liposuction. If they only need tummy tuck, you offer them only tummy tuck. If they need a combination, you offer them combination.
Now back to this woman, by the way.
Yes.
Stretch marks are gone. Where'd you hide those incisions?
The incision.
How low can you go?
The incision. That's a very good question. The incision.
I'm asking good questions today.
Yes,
you noticed that?
I'm proud of you. No, you always ask good questions.
I'm kidding. I'm trying to get you to smile because off camera I know that you're a very funny guy.
Thanks. So, but what happens is, you know, I start talking about this stuff and I get serious.
Okay.
But what happens is that the incision is a low midline bikini incision. It's almost like a French cut bikini. Very important. The central component of the incision is right above the pubic hairline. And that central component I place low because the majority of these mommy makeovers have had C-section scars, which are dimpled. So I go in, I cut out that C-section scar altogether.
Oh, is that right?
Oh, yeah, you bet. There's C-section.
By looking at the photos, she has a nice little symmetry there. We have time for a few more photos.
You bet. So this is the other mommy makeover. I believe she had 3 kids. And the same scenario, she came in, she was, actually her husband was very, very supportive. She came in, she said, you know, I'm
But she doesn't look that overweight in the, she doesn't look so bad in the before. Why not just diet and exercise for this woman?
Look, the thing is this, in her lateral pictures, she had an overhanging pannus.
Like loose skin?
A small pannus of skin, yeah. And with her, specifically with her, she had a C-section scar that was tethered. Okay, so that pannus really falls over that C-section scar. So these people come in and they want to look good. They not only want to look good for themselves, but they want to look good for their husbands.
All right.
Okay? So we took care of her abdominal tone.
Completely flat.
She looks very, very nice, very athletic. She was the one that came back and said, you know what, I never had an abdomen like this. Even before childbirth.
Yeah, I mean, that's a hot abdomen. Looks good, very fit.
Yeah, and her breasts, again, they look perfect, good size, soft, very natural. They match the shoulders to the hips. She's in full symmetry. Okay. Now, the third mommy makeover I want to talk to you about is I had the situation of one of the ladies at our office, her sister. She's in her mid-30s. Wonderful young lady. She's had 4 kids. Again, her body was ravaged by pregnancy and breastfeeding. She came in. We did the mommy makeover on her. These are her pictures. What happens is
huge difference.
Interestingly enough, I don't know if you noticed or not, but before surgery, her waistline was almost square. She had no waistline.
Kind of boxy.
Yeah, boxy. Exactly, boxy. And you know what, Randy? Let me touch upon this.
Oh, you're getting excited again, Dr. Zakhireh. All right.
That's exactly what I hate about these tummy tucks that have that straight vertical incision. That vertical incision is against the body's normal anatomic lines. And when you pull the skin down, when you tighten the muscles, pull the skin down, the patients actually end up boxy, if not barrel-shaped. and
and I've heard that's the problem with the tummy
patient.
tuck on a younger patient.
Exactly, and it masculinizes the patient.
So what do you do?
Whereas this patient, because of the muscle pull that I do, and because of my incision,
Dr. Zakhireh, special muscle pull.
It's all about tailoring. This patient, she has a boxy waist, and after surgery, her waist came in.
So what do you do? Lipo it in, or you're pulling the muscles?
It's a combination of lipoing it, pulling the muscles, and also the incision, the way the vector of the pull. Again, vector of the pull. Okay. Now, this patient, very interesting, because she sent me a thank you card. She's so cute, because in her thank you card she said, Dr. Zakhireh, my pants are falling off of me and I have to go buy all new clothes. I'm not sure if my husband's very happy with you yet.
Is that right?
But no, she was just kidding.
So when they see themselves, oftentimes tears, very emotional, even right away?
Yes, definitely. Definitely. And I mean, it's something that, I mean, I honestly, I don't realize, half the time I don't realize what we do. I don't realize what I do, because for me, it's fun. I do it, have a great time, but for the patients, it's amazing. It hits me when I get their cards and how they've been touched.
Is this the kind of group of patients that they come back and really kind of tell you how it's changed their life?
Absolutely.
Like, what are some of the stories? What do they say?
I
did, maybe unusual.
Yeah, I did. I did tummy tuck. Well, I did a tummy tuck on this one lady. I think I've shown you her picture before, and you asked me if that picture was touched up. She was, overhanging pannus and things like that. And she, within 2 months, she just blossomed into this beautiful lady that was always hiding underneath.
You've explained this to me that some people have a tough time doing something nice for themselves.
Absolutely.
Justifying surgery like this.
Yes. A lot of these.
So what do you say to people watching this?
Well,
that in that same way.
A lot of these moms are the same way. They have been so dedicated, to their husbands, to their kids. They have, gotten so involved with the kids. They have taken care of sick parents or a sick husband, things like that. And, they just are, after a while, they're used to giving and they're not used to receiving, And
interesting.
But it's a transition that they make, and my gosh, we're at the junction of this transition, and it's pretty neat, what happens to these people when they come in and they actually are emotionally ready. And I mean, a lot of these people come in and they talk to you, they're emotionally not ready, they're scared, they're nervous, they've had a consultation somewhere else where they kind of got rubbed the wrong way by the previous surgeon or the previous office. Their guards are up. And they come in, we sit down and we talk to them. I tell them, I said, this is a low pressure. My job is to educate you towards your options. And by the time you talk to them for about 15-20 minutes, they get excited. The husband starts asking questions, the wife starts asking questions, and then it just sort of the momentum.
They have to go in for the consult, meet you.
Definitely. I would advise people to come in, and just when people come in and look into our office, they feel at peace.
It is a very friendly place.
You feel it,
because it can be very
atmosphere.
intimidating going in these places.
Yep, exactly.
Now, by the way, and we're out of time, 30 seconds on safety, because I know you're big on safety.
Very big on safety. You're getting a different level of care at our facility. And I think something that we do, which I honestly don't think most other people do, is we actually send the majority of our patients for preoperative clearance, especially if
to other doctors.
Yes, especially if there's a red flag on their chart, such as their blood pressure is a little high, or their pulse is a little bit low, or they're taking too many blood pressure medications or something like that. We automatically send them for EKG, and preoperative clearance. I send the majority of my breast cases for mammograms.
So if you decide to do surgery, you've, in your mind, it's safe.
Mm-hmm.
Is that the way you feel?
Absolutely.
Okay.
It has to be safe because, this is elective surgery.
What if somebody says, and look, I watch the news. I don't just watch the Wellness Hour, as you know.
Right.
But that was supposed to be funny. Dr.
I know.
Zakhireh.
Okay. I think this morning you actually had the Wellness Hour in your
on my iPod.
That's
what I said, actually. But you're doing a lot of procedures at one time. It seems dangerous. I'm hearing breast and tummy tuck.
That's
some critics would say, "Hey."
That's actually a very good point, and I'm glad that you challenged me on that. I personally don't like to keep my patients on the table for more than 5 to 6 hours. When I do liposuction, I personally don't like to do liposuction over 5 liters at a time.
Okay.
I think that the patients do much better if you break up their surgeries into shorter surgeries. They bounce back much better,
okay,
because they don't they're not as sore, they don't lose as much blood. And also I myself, as a human being, I know my limits, and I know that after 5 or 6 hours my back and my neck get tired and I start wanting to cut corners.
Okay.
So I admit that. And so because of these reasons,
so you keep them short.
The surgeries that I do, like let's say these mommy makeovers and things like that, we've gotten so efficient at them that we do them in 3 to 4 hours.
All right, good. Well, I want to thank you for coming on the show. Very interesting, very interesting. Always a pleasure to have you on the show.
It's a pleasure, Randy. Always good to see you.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.